My name is Adeola Olaitan. I'm a consultant gynaecologist and gynaecological oncologist at HCA UK. The training for gynaecological oncology in this country starts with a general obstetrics and gynecology training. And very early in my career, I realised that I was more drawn to the surgical aspect of obstetrics and gynecology, and gynecological oncology is the most surgical aspect of gynae-oncology. And later on, when I started to train as a gynecological oncologist, I realised that there are diverse other benefits, such as making a sustained improvement in patients' quality of life. And that's one of the greatest aspects of my job. My job involves looking after people with suspected cancer or diagnosed cancer. This means that we treat the patients over a long period of time, and also we follow them up when they're disease-free for 5 or sometimes 10 years. This gives you the opportunity to get to know a patient very well, and often members of their family. Gives you an opportunity to see patients achieve their goals, and going to seeing their children achieve their bar mitzvahs, weddings, graduations, and all sorts of family celebrations. And to be able in some way to make that happen, I found extremely rewarding. A lot of patients who come to see me either have a cancer diagnosis or a suspected cancer diagnosis. They're often very frightened, and are not really sure what might happen. The first thing is, as much as possible, I try and get as much information upfront about the patient as possible, so that when they come to see me, we're in a decision-making capacity. Time is of the essence, and I think that psychologically it's hard if patients have to wait. So we try and expedite things. I try as much as possible to understand their perception and to explain what we know, what we don't know, and how we're going to get the answers to the things that are still unknown. Very often in the first visit, they will have a treatment pathway already worked out that suits them time-wise. And I think all of this helps to allay anxiety. I think once there's a plan, a lot of patients' anxiety disperses.